Senator John, Senator Garcia, you guys have two important bills about opioid addiction. Can you tell me about those?
I would love to tell you about this. I'm actually carrying Senate Bill 193. It is actually going to make full use of the Colorado Consortium for Prescription Drug, the program that we have in the state of Colorado. It's the Colorado Consortium. What we intend to do is, they're housed out of the CU Anschutz Center. We intend on expanding on that so that we can have a national center for the opioid, for prescription drug abuse, and including alcohol and all of the prescription drugs.
Senator Garcia, you've got a pilot program in Pueblo and Routt counties. Tell me about that.
That's right. Yeah, Senate Bill 74 is going to be a new program that we're establishing. Happy that it passed out of Senate Appropriations this morning, 6-1 on a vote that would create a pilot project for Pueblo and Routt County, specifically because we have identified these two counties as some of the highest needs counties in the state of Colorado, but also because these two counties actually have a grassroots approach for counties that are looking to create projects that will come from the counties up. And so a lot of times in the General Assembly, we look to create top-down approaches. These counties have been instrumental in needle exchange programs and a lot of different other programs, and we want to look to complement those.
Well, these seem like law enforcement issues. Why is the legislature taking these on? Why are you guys taking on this issue of opioid addiction?
Well, I think when you look at a state that, the entire country is in an epidemic. It's in a crisis. Some people are calling it a carnage. And Colorado is no different. You know, just in 2013, there were over 259 million prescriptions filled. That is enough for one person, every single person, to have a bottle of pills every single year. So it's an epidemic. We have people dying. So it's a statewide issue. And the rural areas are getting hit really hard.
Senator John raises a great point. Matter of fact, just 2 weeks ago in Maryland, the governor declared a state of emergency. Generally, we like to think of those reserved for weather, but it's so bad there that the governor has declared a state of emergency. So we look at this. This is really a national challenge, and rural communities are being hit and devastated by this. Our program in Senate Bill 74 looks to empower nurse practitioners and PAs to be able to implement greater FDA-approved medications to assist in this medically assisted programs to actually help patients transition. And a lot of different jails and prison systems are also using non-narcotic-based prescriptions to help patients transition. So I think we have to be innovative in our approach because the failure will also mean an increase in healthcare costs and also more deaths.
So it's not just a humanitarian issue, it's also a fiscal issue.
Absolutely. I have worked as a paramedic in Colorado. I'm still practicing as a nationally registered paramedic. I think it's sad that we're seeing not only communities devastated by families also every day. A lot of children, as you've seen, families tore apart by this epidemic that is just devastating. And so we want to make sure that we're providing this assistance. I think there's more we can be doing in rural communities, in Routt and Pueblo communities specifically. In Routt County, they only have identified 1 to 2 providers that are able to prescribe these prescriptions. In Pueblo, we knew that those numbers were 3 to 4. And so we want to look to empower nurse practitioners and physicians' assistants to be able to prescribe these medications.
There is one more point I want to make. In 2013, it was brought to the governor's attention, Governor Hickenlooper's attention, that Colorado was second in the nation with the highest opioid abuse. Therefore, he created the Colorado Consortium, which I was speaking about before. They do amazing work. Their focus is on prevention. But if we bring the most brilliant minds and the researchers together out at the CU Anschutz Center, we can get out the best practices, and we can work with the rest of the country and the rest of the behavioral health folks, et cetera, to come up with the best practices to try and get on top of this epidemic.
Thank you. Senator John, Senator Garcia, thank you.
Thank you.
Thank you.